Hi, my name is Eric Mason, and I'm a physical therapist with Premier Physical Therapy in Jacksonville, Florida. And I'm here to talk a little bit about shoulder surgery. I have rehabbed a lot of shoulders over the course of my years as a physical therapist, using a variety of protocols for a variety of different types of surgery. And I myself am scheduled to have a rotator cuff repair and a slap lesion repair, which is a labrum repair, on my right shoulder tomorrow morning. And as a service to our patients and other people who may be facing this type of surgery, I wanted to do a little video diary and kind of let you know what led up to my decision to have surgery on the shoulder, and then give you an idea of what the recovery is going to be like. I initially injured my shoulder in August of 2011. It was the result of doing a lot of surfing during the great waves that were generated by Hurricane Irene here in Jacksonville, Florida. And I started having some shoulder pain with all the paddling that I was doing, and it gradually got a little worse and worse, and I kept surfing even though it was hurting, and then the pain just never stopped, and I found myself in constant pain, but mostly at nighttime and with certain movements. And I could tell just through clinical testing of the shoulder, trying different special tests and maneuvers, and I could tell that after a few months of the shoulder not getting better, and also the correlation of the clinical testing I was doing on myself, I was pretty sure that I had a rotator cuff tear, and also what's known as a slap lesion, which is a tear of the labrum of the shoulder. So let's just talk a little bit about what that means. The rotator cuff muscles, you basically have 4 rotator cuff muscles that are responsible for a variety of things, including rotation of the shoulder in and out, and also initiating certain motions like raising the arm out to the side. And they also are responsible for helping to drop the ball down lower in the socket as you are raising your arm up, so that your arm can go through the whole range of motion without impinging. And if you get a rotator cuff tear, then sometimes these overhead reaching motions can be difficult, both if the rotator cuff is torn or if it's just inflamed and swollen. When you go to raise your arm up over your head in different directions, the rotator cuff will become pinched underneath the bony roof that's created by the shoulder blade and the collarbone or the clavicle. And that little bony roof sits just above the insertion point of the rotator cuff muscles. And so it's very easy for those rotator cuff muscles to get pinched and irritated. And it used to be that we would see rotator cuff tears, in people like throwing athletes or people that had a fall on an outstretched arm. Now we're seeing more rotator cuff tearing as a result of repetitive motion, repetitive stress and strain. And a lot of it, I think, has to do with people spending more time on their computers, and their shoulders are becoming more forward rounded. And with the forward rounding of the shoulder, the rotator cuff is in an environment where it's more prone to pinching. Perfect example of that would be if I get myself into a good posture and I pull my shoulders back and I get my shoulder blades kind of pinched together behind my back, it's very easy for me to raise my arm up over my head. The rotator cuff is not being pinched, the shoulder's in a good environment. But if I were to slump my shoulders and let them round forward, and I try to raise my arm overhead, that's about as far as it's going to get. So the combination of poor posture and repetitive overhead activity. One of the problems with forward rounding of the shoulders too is that the rotator cuff muscles now have to kind of fire on a constant basis to try to hold my shoulder in socket, whereas if I'm in this position in a better posture, the rotator cuff muscles don't have to fire quite as much, and they are less prone to injury. But in this rounded posture with the rotator cuff muscles firing constantly as almost like a postural muscle, they become irritated a lot easier too. So I think in my case, it was just too much overhead activity, probably some forward rounding of the shoulders, and then I ended up with a rotator cuff tear. Now the slap lesion, that's basically a labrum tear, and the labrum is essentially a circular cartilage structure that reinforces the socket of the shoulder. So if you can imagine a ball and socket joint where you have a very shallow socket, and then the labrum is actually like an O-ring. It's like a cartilaginous circular structure that sort of reinforces the walls of the labrum, of the socket, and allows for some pooling of fluid and some, allows for some extra motion at the shoulder. And that labrum, unfortunately, like the rotator cuff muscles, does not have a very good blood supply. So when it gets torn, it doesn't heal real well on its own. Anyway, depending on where along that circular labrum your tear is, it has different names. My tear is up at the top of the labrum, which is also where one of the heads of the bicep muscle attaches. And so when you get a slap lesion, which is basically at the very top, at the 12 o'clock position of the labrum, that's also commonly involves the bicep tendon as well. Your bicep has essentially two heads. That's why it's called bicep, because it has a short head and a long head. The long head of the bicep comes up and attaches on the very top of that labrum. So when that tears, the bicep is involved, and that can cause quite a bit of pain and impingement in the shoulder as well. And a labrum repair usually involves anchoring, suture anchors that go into the bone, and then they usually suture that down so that it becomes more flush against the surface where it's supposed to be. Same thing with the supraspinatus tear or other rotator cuff muscle tears. They'll typically put bone anchors into the bone and then suture that muscle back down to the bone, and then hopefully over time, with the proper healing and proper therapy and protocols, the supraspinatus or the other rotator cuff muscles will sort of reinterdigitate with the bone, and you'll end up with a solid repair. The slap lesion and the rotator cuff tear, typically when those are repaired together, you are put in a sling. They usually put you in what's called an abduction sling, and that's a sling that holds the arm out away from the body, and that will keep the arm still, and what they're trying to do is keep you from contracting the muscles or moving the shoulder excessively so that you don't pull the threads out of the meat, so to speak. And typically you're kept in a sling for 4 to 6 weeks after surgery and not allowed to do any active motion of the shoulder. The only thing they allow you to do after surgery for the first few weeks is to take the arm out of the sling and just let it dangle. They'll have you bend over and do pendulum exercises or Codman's exercises where you swing the shoulder, but you use your momentum of your body to just let it sway or make circles, but you are not allowed to actually move the arm yourself because you don't want to contract those muscles forcefully and pull the suturing devices out. So typically you're in the sling, you'll go to physical therapy, and the physical therapist will move the arm for you, and sometimes you're restricted in the range of motion that you are allowed. So I think I'm only going to be allowed to move the arm to about 120 degrees in this direction, 90 degrees in that direction, and then 45 degrees of each of the rotations. And I'll be limited to those motions for maybe 6 to 8 weeks, and then progressively allowed to get more motion, and then eventually strengthening. So it's pretty long recovery. It's about a 12-week rehab protocol, but typically to get back full motion, full strength, and full return to sports participation, you could be looking, to somewhere from 6 to 12 months to really get back the full function of the shoulder. So when some of the testing that we do to determine what type of problem is in the shoulder, obviously, you have an MRI, and a dye contrast MRI is usually very effective at showing what's going on inside the shoulder. But in clinical testing, what convinced me that I had a problem that was not going to be able to be rehabilitated conservatively was, first of all, it's very difficult for me to raise the arm out to the side. I get an immediate sharp pain when I try to do that. Also, if I try to resist external rotation, which is this rotation motion here, when I try to resist that motion, I get an extremely sharp pain. The other interesting thing is that if I do a bicep curl with the arm out away from my body and I curl, I can do that without any pain, because that really is isolating the short head of the bicep. But if I bring the arm past the plane of my body and I do a bicep curl in this plane, I get sharp pain from that, because that's engaging that long head of the bicep. which comes up and attaches to the torn part of my labrum. So when I sort of isolated those things out, I was able to come to the conclusion that I had a labrum tear and a supraspinatus tear. And when I had the dye contrast MRI, that's what was showing on the MRI. So I pretty much had relentless pain for 6 months leading up to the decision to have surgery. Mostly pain at night that kept me awake, and also pain with motion and finding it difficult to do anything that involved pushing. I'm okay in this direction. I can raise the arm up pretty good in this plane. Definitely can't raise it up out to the side very well. I'm okay reaching behind the back, but anyway, it is interfering with my ability to do my job. It's interfering with my ability to sleep at night and interfering with my ability to participate in recreational activities. So, and after trying to do a lot of rehabilitation, which includes trying to strengthen the rotator cuff, trying to maintain my range of motion, and trying to optimize my posture, I just found that I could not get rid of the pain. And at that point, I made the decision to go ahead and have surgery. Now, there are people that have rotator cuff tears that become asymptomatic. There are people with labrum tears that become asymptomatic. And we rehabilitate a lot of people with minor shoulder damage that, over time with the proper posture optimization and scapular strengthening, shoulder blade retraction strengthening, rotator cuff strengthening, all of these things can actually become asymptomatic and avoid surgery. Sometimes cortisone injections, either an in-office cortisone injection or what's called an intra-articular cortisone injection, which is where you have an injection of cortisone in the joint underneath an x-ray machine so that they can guide the needle into the joint. Sometimes that can help people and they can get better. There's a variety of things that can be tried prior to consenting to a surgical procedure. I tried all of those things, didn't get any better. So I'm going to go ahead and have the surgery and hope that I have a full recovery. And I will be checking in with you guys to sort of give you an update on how things go right after the surgery, and then I'll be checking in regularly to show you how the rehabilitation is going. And going into the surgery, I'm going to be expecting a few things. One is that you typically will sleep upright in a reclining chair after surgery because of the discomfort of trying to lie down in a bed with the sling and the resulting shoulder pain. The other thing that some people don't realize is that after the surgery and having the arm immobilized in a sling, the armpit area can become very irritated. So we sometimes will suggest that people, again, try to get out of the sling periodically and let the arm dangle. It may be a good idea to put a little bit of powder in the armpit to try to keep it from getting too moist and maybe developing a fungal infection in that area. So that's something to consider. The other thing to consider is that when you're in a sling for a long period of time, the bicep will get tight and you'll end up with an elbow that's hard to straighten. So we suggest that people get out of the sling and let the arm dangle and try to get a little bit of a stretch on the bicep. Everything has to be very gentle and careful. And of course, if you are undergoing a surgical procedure, obviously follow your doctor's protocol. This video is only intended for informational purposes. I'm not here to tell you how to rehabilitate your shoulder or how to treat an injury. I'm just giving this information for informational purposes so that you kind of know what to expect. All right, so we'll be checking in sometime tomorrow after the procedure, and I'll let you know how it goes. Thanks.